How's this? Well, good morning.
Good morning.
We have so much to celebrate, and we're so glad that you're here today. It's so nice to see your faces and gather together once again. And hello to those of you who are joining us on YouTube today. This is a big deal to meet in person. Yay. And also be yay. And to be streaming on YouTube. This is another new thing for us. So let's say yay. Because of Amber's perseverance last year, we got to meet for the last 2 years, we've gotten to continue to meet and continue to work using Zoom. So this is just wonderful. I do want to give you a heads up. This is Debbie Kitchen. She hates to be the center of attention. So I'll say it again. This is Debbie Kitchen. And sitting in front of Debbie is a computer. So anybody that's in this immediate range, there might be some ambient noise. So if you have a tickle in your throat, you're going to tend to cough or sneeze, you might want to move away from there so the people at home don't have to share that with you. So my name is Janet Belkenich. I'm the president of the league, and I am so amazed by the work that this group of committed volunteers accomplishes day in and day out, year in and year out. And I invite you to give yourselves a round of applause. That was really pretty lame. I'm glad you worked hard on that. So let's try it again. Thank you. So we have so much to celebrate today. Will our outgoing and incoming board members stand up to be recognized? There we are. Thank you. If you knew how committed these people are behind the scenes, you would be so proud and grateful. I'd also like to recognize Connie Taylor as the 2021 recipient of the Above and Beyond Leadership Award. Diana Carney received an Above and Beyond Award for her newsletter. She's been writing the voter newsletter for us for a couple of years. So she received an award as well, but she wasn't able to make it today. So when you see her, please be sure to tell her what a great job. I was amazed. That's one of the things that made me want to join the league, was the quality of our communication. And lastly, if you have joined the league within the past 2 years, since we last met in person, will you just give a wave? Oh my goodness. We're so excited to have you here. And after the meeting, we invite you over to the table where the blue wall waiver is supposed to go, so you can meet other new people and get better acquainted. And now, I would like to introduce Andrea View. Andrea is our co-vice president. She was spotlighted in the voter this month, so you probably already know what an accomplished person she is. I love to say things about people when they get really embarrassed. It's just, that's the little devil in me. She's a professor of political science at Johnson County Community College and a lifelong learner with a bachelor's degree and PhD in political science and through a master's degree in nonprofit management. And Andrea has been a wonderful advocate for the league. And now I'll turn it over to Andrea.
Thank you, Janet, for that introduction. Can you hear me?
Yes.
Good. So welcome and thank you, Janet, for the lovely introduction. I am Andrea View, one of the co-vice presidents, and I work alongside Connie Taylor, who is also a co-vice president. Connie and I have an exciting program planned for you today centered on mental health awareness and how to spread empathy for folks dealing with mental health needs. So to that end, we have a couple of wonderful panelists with us, and I'm going to briefly introduce them, and then we'll get started. Our first panelist here is Tim DeWeese, the director of the Johnson County Mental Health Center, which is a position that he has held since 2014. He has a bachelor's of science in psychology from Missouri Southern State University and a master of social work from the University of Kansas. Tim is a licensed mental health professional in Kansas and has over 30 years of experience in community mental health, where he's worked in various capacities. He possesses extensive knowledge and experience in public mental health delivery systems, client-centered leadership, and program design and development. Tim also served more than 10 years as a commissioned officer in the Army Reserve and National Guard. The Johnson County Mental Health Center, just as a brief plug here, also oversees the Zero Reasons Why Teen Council based in Johnson County. And Zero Reasons Why is a program focused on removing the stigma surrounding mental health and mental health needs, and works to educate the community and build up support networks. Next, we have Alicia Breithoff, who is a counselor at Johnson County Community College and a member of JCCC's Mental Outreach Committee. She has a bachelor's in psychology and a master of education in educational and counseling psychology from the University of Missouri-Columbia. In addition, Alicia recently completed a sabbatical project on suicide prevention and education. And overall, she provides educational planning, career, and personal counseling, and is committed to meeting students where they are as individuals and providing resources and supports as they pursue their educational path. Finally, before we get to the discussion, I did want to share some fun news that we've all learned. The Johnson County Mental Health Center is currently celebrating their 60th year, and the League and the Mental Health Center have a long partnership dating back to 1959. When the League conducted research and advocated for the establishment of county mental health resources. So that eventually led to the Johnson County Board of Commissioners approving the creation of the Mental Health Center in 1962. And so it's kind of a perfect time to celebrate the work of the center and also the League's commitment to mental health awareness. So we're happy to have everybody here. So with that, we will turn to our discussion. And the first question for Tim. You have a lot of experience bringing awareness to the importance of mental health and ending the stigma surrounding mental health needs. How can average folks help raise awareness about mental health issues and taking care of one's mental health?
So that's a really good question. And I think that the first thing I would say is that if we think about stigma, stigma is really not unlike what we've experienced over the last 2 years. It's a virus similar to COVID, and we have to find a way to utilize the antidote against that. The interesting thing about stigma, though, is that we know what the antidote is. It's empathy, passion, compassion, kindness, and grace. And so when we begin to talk with people about their mental health issues, or if we learn someone has a mental health issue, that providing that empathy, providing that kindness, providing that support and that grace, that is how we begin to stabilize or to remove that stigma. The other thing I think is important to remember is that one of the reasons that the stigma exists is that we don't view it the same as mental health, or mental health is not viewed as the same as physical health care. And so, 30 years ago, when my father passed away due to prostate cancer, back then we didn't talk about cancer. We didn't talk about testicular cancer. We didn't talk about prostate cancer. It was the C word. And now we fast forward 30 years later, and there is discussions about all types of cancer and making sure that you get screenings. And so there is no hesitation to discuss physical health care issues. We need to be able to get to the ability to have those conversations about mental health just the same as physical health care. So that when we talk about someone who has depression or someone that has anxiety, that we view that no differently than if someone has hypertension or if someone has diabetes. And so we have a long way to go to be able to see mental health issues as healthcare issues. So I think that is one of the things that will begin to stabilize or to remove the stigma associated with talking about mental health or even seeking mental health. We wouldn't hesitate to go to our doctors for a physical health care issue. And we need to get to the point where we don't hesitate to actually have the conversation and go seek professional help when we have anxiety or depression.
Thank you. And Alicia, I'm curious, what can the average person do to support their own mental health and the mental health of others.
That I think is the key to it all. I think when you talk about others, you're looking at that ability to listen. And also I think that can be very intimidating if you're not comfortable maybe with hearing about what someone may be going through, but just the ability to be present and listen. One of the things that we use a lot at the college and for training for our faculty and staff is a wonderful program called Ask, Listen, and Refer. And that's what I would encourage, is that ability just to be present if someone is expressing a concern, that you don't have to be the one to solve the problem, but if you can be present and then maybe be with them to help them make that phone call or reach out for support. Whether they feel more comfortable reaching out to maybe their general practitioner, or if it's calling 1-800, the National Suicide Hotline number, or calling Johnson County Mental Health. It's really just coming up next to someone. You don't have to be an expert. You don't have to be a counselor. You just have to be there because you care about that person and just be there with them. So again, you don't have to, I think that's one of the challenges people have. They feel like they have to fix it for somebody, or they have to be the one that is the only person. And the most important thing about mental health is that support group and that support system is very expansive. So it's not only one person, that you should reach out and find those experts and refer those individuals to where they can talk to somebody that has that expertise, so that you can be that conduit and that support for them, but that you're not the one that has to be the one that provides that care. As far as individuals and yourself, about taking care of yourself, that comes in many shapes and forms. We all hear the traditional thing of, go take a nice warm bath. And that's wonderful and everything, but there's so many other things that comes with mental health that are really straightforward and simple. I would say today's sunshine is all about mental health. How many of you are tired of the rain? Weren't you glad to see that big yellow ball of sunshine? So I think that, that is so significant too, is just knowing what I approach it as gratitude. And so it's one of those things that I find when I work with students. The average age of Johnson County Community College is actually 27 years old, although we do get 1 out of every 4 Johnson County high school seniors each fall, so we have a traditional age too. However, my point is working with those individuals and helping them understand the simple things that they can appreciate in their life. So I think for individuals, it's understanding that gratitude piece. It could be, again, that the sun is out today and it's better than yesterday. And so it's still great to take a warm bubble bath. Those are all good things, but I think it's appreciating the simple things on a daily basis. And also, I think for individuals too, just taking it one day at a time. You probably have heard that many times, but focusing on the moment and being where you're at, instead of, because I think that's the biggest challenge, is that for individuals struggling, it's a lot of that anxiety and that frustration about long range. And so just trying to help yourself stay in the moment where you are, and identifying those things that are just the simple things. And so again, I think with mental health for yourself, it's also, there's a lot of research that shows being outside in nature, whether it's taking a walk, if it's to the end of your driveway, or if it's around the block, but doing something and getting yourself out of where you are currently. So I think it's both physical gratitude and again, just being in the moment.
I think one thing that I would want to add to that is, as we mentioned, the suicide prevention hotline, as well as calling Johnson County Mental Health Center. As of July 16th of this year, all you have to remember if you're in Johnson County is to dial 988. So 988 will get you connected in Johnson County with a mental health professional from Johnson County. And so it's very easy. It doesn't have to be a situation where someone's at immediate risk of self-harm or having thoughts of suicide, but it's anyone that has a question about mental health, anybody that's concerned about a loved one. All you have to do is dial 988. You'll be connected with our call center here in Johnson County, and we'll be able to get people connected with the right level of care. And so that actually goes into effect, and you'll see a lot more information about that starting in July. It's actually effective right now. If you dial 988, it will come to us, because we've already set that up. But just know that if you have questions, if you want to help someone and you want to stay present with that person and help them get connected, there's a much easier way to do that today than ever before.
And that's a great transition into the kind of the next general question related to the pandemic. And I'll direct this to Alicia, but I think you both probably have some good insights here. How has the mental health support landscape changed as a result of the pandemic in terms of both needs and maybe resources?
Well, definitely, I would say the need has spiked more than I've ever seen before, and obviously Tim can speak to that even more so. Again, because of the isolation that people felt, and the apprehension, the fear of going through a pandemic, and what does that mean, and what does that look like. And I think we definitely were dealing with several generations that had not really had something like a world war or significant global issue. And so the concept of resilience was a lot lower, I think, than previous generations. So we've seen that definitely with our students. I think, again, I'll speak specifically from the community college perspective. We had these students that were the traditional age that spent 2.5 years at home. I mean, literally at home with their families. And so even at the community college, we have seen issues with students making that transition back into social situations, and having, the resilience to get through a difficult situation. And so I never experienced homesickness at a community college, and we had students that were having those feelings of separating from their families after having been living at home for over 48 months. So I would say the need is definitely increasing, as well as we have international students at the community colleges. So just what they were experiencing of not knowing the certainty of when they could go home or how they would get home or how their families were doing. So we saw a huge increase with that. As far as the response to that, I'd say there's some certainly things happening. There's definitely more of a dialogue, I think, nationally, and certainly this program today. So thank you for the gift of time to be able to have these conversations. I think also what we're seeing locally too, and Tim can talk more of it too, but we have a partnership now with Johnson County Mental Health at Johnson County Community College. So our students, when they engage with us as counselors at the community college, we are all counselors at the master's level counselors. So we've dealt with personal issues, we do crisis response. The exciting thing with Johnson County Mental Health is we now have an embedded clinician at the community college. So again, we can immediately refer to someone that is present. Many of our students have transportation issues, so even getting to locations to meet with a clinician can be a challenge, and I think that has been a great partnership. It's getting a lot of traction, and a lot of students that are needing that more connection and support as they're navigating higher education and their lives. So I think there's a lot of resources that are being applied more to mental health and opportunities in our community for people to reach out. And I know it was even before COVID that the 988 was coming along. So there definitely is a trend. And then also from what you mentioned earlier, the 0 Reasons Why, and on College Camp, which is a student organization that students in high school support those conversations about mental health. At the college level, there's a program called Active Minds. And those two groups are starting to connect with each other to help students make that transition from maybe K-12 into higher education. And so I think the other national trend is seeing that movement, that mental health is a part of who you are from wherever you are and all through your life. And so I think those programs connecting are definitely creating a greater dialogue and resources for people.
So from my perspective, I think that we have to come to a realization as a community, as a country, as a state, that we've experienced trauma over the last 2 years. I've not met anyone that hasn't said that the last 2 years have not been difficult. The fact is that the last 2.5 years have been very difficult. They've been very traumatic. From the mental health center's perspective, we have primarily always worked with individuals that have severe and persistent mental illnesses, and those kids that have severe or serious emotional disturbances. What happened over the pandemic is not only did we have to serve that population that have historically been impacted and disproportionately by all kinds of things, access to health care, poverty, a number of things. But then we had this whole other set of folks that were experiencing trauma because of the pandemic that were needing support. So we've seen a 2/3 increase of people coming through our front door. We've seen in 2019 on our crisis call center and being able to see people via our crisis center, we roughly saw about 30, just over 30,000 in 2019, 30,000 individuals. We will have more than 50,000 contacts and see 50,000 individuals just in this year. So we've seen that progress each year that the pandemic has gone on. So that has been the huge strain on the mental health center. So providing services to the people that we've always provided to in a little bit different way, but then also being able to respond to the traumatic events that people have experienced that maybe hadn't ever needed mental health services before. At the same time, I think it's really important that we realize that the things that keep me up at night, the things that I worry about for our community, things like the suicide rate, things like the number of overdoses, things like this need to be perfect in our community, all of these things that worry me about our community, they all existed well before the pandemic. They just were exacerbated by the pandemic. And so I think it's important that we realize that the pandemic has actually shown a light on all of the things that we need to focus on. And so for me, as we move into our new normal, or whatever you want to call it, it's an opportunity for us. It's an opportunity for us to address some of these things that have been negative pieces of our community for a long time. Homelessness is another issue. There is this epidemic of loneliness that has permeated the United States and our community particularly. And I don't fully understand it, primarily because we are the most technologically advanced society in the world. And yet when we talk with people, they report being more lonely than ever. And why is that? Well, I believe that the reason it is there's a couple of reasons. One, all of those things that keep me up at night, they're exacerbated. They're exacerbated by this technology. And so I think we have to get a understanding of how technology can impact our lives in a positive way, but also how technology impacts our lives in a negative way. So at the beginning of the pandemic, we talked about making sure that we socially distanced ourselves from one another. I think that was a mistake. We needed to physically distance ourselves from one another, but we needed to stay socially connected. The key for us, and the reason that I believe that we report being so lonely, is that we have gotten away from authentic human relationships. The power of a human connection is the most powerful thing. It's the most powerful medication. And we know that as counselors because we see that interaction. But the fact is that we, as individuals, have focused on this way too much than this. And what we need to get back to is authentic human relationships. We need to focus on what's real, R-E-A-L, as opposed to what's real, R-E-E-L. And because this isn't real. What we see on Facebook, what we see on Instagram, what we see in social media is not real. And it only exacerbates this need for perfection. It only exacerbates this feeling of loneliness or isolation. And so I think that is what the pandemic has really brought forward for me, is it's been difficult. We have to admit that it's been difficult. We have to admit that there are issues within our communities, and that we have to then also admit that technology plays a role in exacerbating that. It can play a role in helping it too. But right now, we don't focus on the negative impacts that technology brings. And I think that I'm hopeful out of anything will be what we continue to discuss as we move out of the pandemic into kind of a new normal.
Andrea, I was going to share one more thing too. Along those lines, certainly that is all very, very real. One of the things that has changed, I think, can be constructed with technology, and I'm sure Tim has experienced it too, is also the telemental health component. And so I know, like, when I thought I had to talk to my doctor over a telemental health, I'm like, how can they take my blood pressure? You know, I mean, so some of it doesn't make sense on maybe the physical health side, although there were times. But we've seen definitely, because of the pandemic, we were talking about that as well, that a lot of our professional organizations are reevaluating what state lines mean and what licensure means. So there was a immediate response that, you know, again, I guess my world is really the college world, but it's the whole world. You know, a lot of students stayed home from college. They were residing in different states. And so there was a strong movement to, with regulation, you really couldn't cross state lines with some licensure type things. But telemental health helped those people have that connection, have those conversations, not feel so isolated. And so that was a good use of technology, even with, you know, the social media component, which we all know is obviously very unhealthy. But the telemental health and the community college, we began offering our services again over Zoom. And now 55% of our students like that interaction over Zoom because they're busy, they have lives, they have things going on, but they can still get the support and services they need and the connections. So I will completely agree with Tim. There's nothing that can replace that human interaction and that face-to-face, and that would always be my preference. But technology did help with mental health through the pandemic, and has now become a new practice for people that, again, may be in a rural area and can't always get to resources. So I would say that's one of the improvements we've seen or outreaches because of the pandemic.
I think the one piece that I'll add to that is that that is absolutely the case, and we had to shift on a dime to move to be able to use technology in that way. Unfortunately, not everybody has access.
Mm-hmm.
Not everybody has access to a mobile device. Not everybody has access to the computer. Not everybody has access to the internet. And so, again, what we have to make sure is that we don't create more disparities within a healthcare system that already has a ton of disparities. So I think that telehealth absolutely is a way to enhance the services that we provide. Human connection is, and I would fully agree, is the number one thing, but we also need to make sure that we don't create more disparities within a healthcare system that already has way too many disparities.
Jumping back, a couple of times already we've mentioned the 0 Reasons Why Teen Council, and I know that's facilitated through the Johnson County Mental Health Center, and you are heavily involved with that. I'd like, for you to just tell us, what are the programs, what's the mission of that organization, how does that operate?
So 0 Reasons Why was actually started by the 6 superintendents of the 6 school districts and myself. They reached out to a number of key stakeholders back in 2017 when we saw an increase of youth suicides. And I think we were up around 20 in the single year. And so they were tired of seeing their students die by suicide, and they said, we need to do something. At the time, what we said was that whatever we didn't want it to just be kind of a flash in the pan, that it needed to be something sustainable. And we also thought that who better to ask about what we could do than the students themselves. And so that is where 0 Reasons Why began. And the purpose of calling it 0 Reasons Why is because there are 0 reasons why someone should take their own lives. There are 0 reasons why we shouldn't talk about mental health. And so that was the key. 0 Reasons Why is actually a student-led campaign to bring about awareness of mental health and mental health issues and disrupt youth suicides. It's in all the school districts. We have now moved into a number of private schools as well. And now that we have some graduates going on into college, we've seen that actually pour over into college campuses as well. And again, it's an opportunity for young people to come up with the way that they believe they can communicate with one another about the importance of mental health, to share their stories, and to provide support and hope to one another. And for us adults to kind of just stay out of the way and facilitate it. And that's what we've been able to do. And so after the first couple of years, the 6 superintendents felt like in order for this to continue, that the Mental Health Center would be the best organization to continue that community-wide. And so that's what we've done. And it's really ran by a group of teens at what we call a teen council. There's typically juniors and seniors, but this year they really focused, the kids really wanted to focus on sending the message to middle school, because everyone, all the teens that we talk with are really clear that middle school is the hardest time. That by the time they get to high school, it's a little bit easier, but that middle school is really the toughest time for youngsters. And so they wanted to move things more towards middle school, so that's what we did. So 0 Reasons Why, you'll see that across, there's a website that you can access. It's actually also expanded across Kansas. So there's also 0 Reasons Why Central Kansas. There's 0 Reasons Why of Sedgwick County. So we've seen this begin to pop up in different parts of Kansas. And actually, even now discussions are popping up on the Missouri side, up in Des Moines in Iowa. And so it's really a movement to really disrupt youth suicide. So where are we with youth suicides? This last year, we unfortunately had 5 deaths by suicide of young people. But that's a long way away from 20, where we were in 2019. So we've seen a gradual decrease in the number of youth suicides in our community. And I feel more committed than ever that we can actually get to 0 suicides. And I think that is something that we have to continue to strive for. A lot of times when I ask people what do they think the key demographic is with suicide and death by suicide, they always say young people. And the fact is that middle-aged white men is the demographic that has, for as long as I can remember, been the demographic that's most impacted by death by suicide. And so that is another area where we need to focus, is how can we focus on across the board, not just youth suicide, but how can we begin to have this discussion so that we decrease the number of deaths by suicide, so that suicide is not something that we in our community have to deal with. It's preventable, and we need to find a way to make sure that we work hard to prevent that.
One of the things that I'm interested in hearing about, and I'm going to broaden this out, I think, we're talking a lot about students certainly, but I think it can apply to generally the community as a whole. It's kind of what you're alluding to. What kinds of resources and awareness do we as a community need to think about to help, prevent suicide, to raise mental health awareness? Certainly having programs and being open about it is one step, but I presume there are steps beyond that.
So I'll go first. I think that the first thing that I would say is that something that we mentioned earlier was that we need to begin to see mental health equally as important as physical health care, so that when we think about treating physical health care, we also think about treating mental health care, so that when we get checkups, when we go and get our annual checkups, that we also have a checkup from the neck up, so to speak, so that we're making sure that our mental health is equally as important as our physical health care. I think that also has to do with legislation. Quite frankly, I think we have to legislate that mental health be on the same level as physical health care. So we call that parity. That we have the same type of coverage for mental health conditions as physical health care conditions. Right now, depending upon your insurance, you don't know what your health care is going to, your primary health care is going to be consistent, but your mental health care is going to vary Some people are going to have some coverage. Some people are not going to have coverage. Some people are going to have co-pays. Some people are going to have a lot of out-of-cost expenses. And so there needs to be, this is going in and out, there needs to be a process by which we have a set of benefits that are consistent for mental health conditions, just like we have a set of benefits that are the same for healthcare conditions. And that has to be legislated. That has to be part of insurance legislation so that we can ensure that, I could also talk really loud, so that we can ensure that people have the same coverage. The other piece to that is that we need to make sure that we have access to care. Access to care is, in my opinion, the number one thing. So I've worked at Johnson County Mental Health Center since 1995. I've got to grow up in the organization that I now get to lead. That doesn't happen very often. But what I've seen over the course of the last 30 years is that when someone gets the courage to call and ask for help, what happens is we say, okay, we'll see you in a couple weeks. If people needed help in a couple weeks, they'd call us in a couple weeks. And then we wonder why our no-show rate was high. Well, that's because we weren't able to provide people the help when they needed it. The second thing is that when people did come in, they did keep those appointments 2 weeks later. Then we said, okay, well, we truly think that you probably need a combination of therapy and medication. So we'll get you connected with a therapist, but now medication, it's going to be another 8 to 10 weeks before we're able to get you to see a psychiatrist. And so now we're talking from the time a person got the courage to pick up the phone and ask for help, we're 3 months, 4 months down the road. That's not access to healthcare. And so what we have to do is find out how we can create a system that provides access to care when a person needs it, so that we embed clinicians within Johnson County Community College. We embed clinicians with our law enforcement, our co-responders, so that when a police officer arrives to a home and it's a behavioral health situation, they can immediately start providing mental health interventions. We have 21 co-responders now across Johnson County in all jurisdictions. It means that when someone calls a mental health center and says, I need help today, we say, what time can you be here? We don't set up appointments any longer at Johnson County Mental Health Center for intakes. We ask people just to come in. And so that's called an open access model. We really need to be able to have the ability to have people access care when they need it, in the moment that they need it, not 2 or 3 weeks down the road. So in my mind, the way that we begin to shift this dynamic is that we find out how we can provide access to care immediately, that we ensure that that care is consistent regardless of how rich you are, poor you are, what type of insurance you have or don't have, that there's a consistent way of treating each individual. And I think that if we begin to do that, and if we can promote that, if we can move that, those notions forward in policy and in practice, then I think we'll begin to see our communities live healthier lives across the board.
And I'm always in awe of Tim's passion. I would say that a lot of these changes have been under your leadership, Tim, and so that has been a great gift for our community. Again, just the exponentially how it has been more of a conversation in our community. When I did my research in my last sabbatical on suicide education prevention, I worked closely with like the Olathe School District. They were doing some amazing things, certainly talked to people in Blue Valley and Shawnee Mission and a few other school districts. So the point about the middle school issue is very, very real. One of the things I think that I found too was the other organizations that are out there that are doing walks, mental health walks, to create that awareness. So bringing that to all of you to encourage you that there are programmatic ways and awareness that can be created. There's the Speak Up organization that does a mental health walk. There's another organization called UVU, and that was originally, I think it's still out of the Jewish Community Center. So again, there's a lot of ways to get involved in different organizations and to be a part of those with and helping to educate yourself. I would imagine that most people in this room know somebody or have somebody that has struggled with mental health or yourself. And I think finding those constructive ways to get that message out, to be part of a group, is definitely a progress that we've seen. And so I think probably that involvement piece, it doesn't have to be something you do all the time, but if there is a designated program, just being part of that or participating or getting someone that you know to go with you that might need that connection. So again, there's a lot of resources, or a lot of organizations that are focusing on mental health and being part of our community.
I think one other thing that you just reminded me of is while all of those organizations are out there and they do some great work today, actually is this morning, NAMBI had its mental health awareness walk and couldn't be there because I was going to be here with you all. But I have staff over there participating. The other thing is, you know, growing up, we always had Red Cross first aid training, and, you know, you had to go out and get first aid training. There is something called mental health first aid. Mental health first aid is a first aid training just like the Red Cross first aid training, but it's focused on mental health. And so I would encourage anyone in the audience here is if you haven't looked at the opportunity of getting mental health first aid training, you should do that. You can find, we provide those opportunities throughout our community. And in fact, if we wanted to partner with the League of Women Voters and just do a mental health first aid training here for everyone and get everyone mental health first aid trained, we could do that. But that's an opportunity for everyone to get some basic understanding about how to intervene and how to support someone if they're having a mental health crisis.
Thank you. That's a great, it's like, we'll take you up on that. I also wanted to point out, Alicia, when you and I talked before, you talked about some of the apps that people can put on their phone and meant to deal with suicide prevention and mental health crises. Could you tell us a little bit about those?
Sure, absolutely. Actually, and one of the things I probably did was, and my cell phone's over there, I'm trying to stay away from it. But in your cell phone, what I probably showed you that day was when I have work with friends, family, students, in my phone, I have the word suicide, and I have 7 or 8 different hotline numbers in my phone. And that's where I tell individuals, again, whether they're students or not, but we have faculty and staff come and talk to us as well, that having that resource accessible, because again, we all have our phones with us at some point. And so knowing what the hotlines are out there, so the 988 is huge as far as actual direct resource. There's specific hotlines for veterans with mental health. There's hotlines for LGBTQ members. There's hotlines for Spanish-speaking people. So knowing what those resources, and so when I do presentations on mental health at the college or in the community, I always make sure that I make that one of my slides, and I ask people to pull out their phones and put those numbers in their phone, because you never know when you or someone else will need that, and having to go look for it is stressful. And so there are apps out there as well that people can do. I mean, mostly, I guess, the ones I work with are the calming apps that people have used. Just when they're in a place of stress or anxiety, to just kind of walk them through some breathing, kind of help them shift their thinking. There's a gratitude app out there. And so those have been great tools that are just really, they're free. You just download them and they're on your phone. Again, I'm with Tim that I think there's a lot of negative things with social media and phones, but then using the resources that we have that are immediately accessible. So I don't know if there's something you prefer.
No, I would absolutely agree. There are a whole host of benefits to technology. And what we have to do is utilize those benefits, but be able to mitigate the not good benefits. And so that's that fine line, and that's why I like to have the discussions, because technology is wonderful. It's huge, and there's a lot of benefits from it, but we also have to be realistic about the negative impacts. I think the calming applications or the gratitude applications are really, really good. And there's a couple of reasons. One, gratitude, being able to and mindfulness. When I talk about what we can do as a community to be more thoughtful, it's in kind. It's also about providing gratitude, but also being able to regulate our emotions. And what I like to talk with young people as well as adults about is that, because honestly, I think as adults, we have a harder time with this right now. I think civility is all but absent. I've said that it needs to be put on the endangered species list because I don't see it anymore. You know, we need to get back to the ability to actually respond to situations thoughtfully rather than react to them emotionally. And so for me, these apps are really good at helping manage that emotion, helping you be able to ground yourself, center yourself, breathe, and be able to respond to situations as opposed to react to situations. And I think that's huge, because when we respond, we're being more thoughtful, we're being more kind, we're being more grateful. And it's then when we can actually have civil discord, which is huge. We need to be able to have the ability to be civil and disagree. We can't do that today. And I think that's because we have not, we've lost the ability to really live in our emotion and ground ourselves so that we can respond to one another and what we're hearing and listening to. And so I think that those apps, for a number of reasons, both with employees at the Mental Health Center, our clients at the Mental Health Center, folks in general, we would encourage them to utilize those apps to really help ground themselves.
Andrea, could we ask people to start writing?
Yes, that is, and so with that, we will move on to question and answer from the audience. There are index cards on your chairs with the other items. And so you can write your question, if you have questions, you can put them on the index card, and then my microphone's
Going in.
yeah, I'll yell. And then we have some volunteers picking up the cards, and they'll bring them forth so that we can get to some of your questions. One of the things as we're waiting, I was pulling out two themes just now. One is the prevention theme, and the other one seems to me to be the preparation. So being prepared in case somebody that you are around is having a mental health crisis, and being able to respond real time effectively. Certainly calling crisis lines, speaking with empathy, those might be some ways that we can respond effectively. I want to make sure we didn't miss any key pieces to that.
I think that we mentioned earlier that the ability to listen. I mean, I think that's another thing that we've lost. That's why we have 2 ears and 1 mouth. We need to be able to figure out how to be quiet and listen intently, and be okay with silence. Be okay with that awkward silence, because if you move past that awkward silence, typically a person that is having a difficult time, they will then begin to share more. They'll feel safe to share more. So creating a safe environment where you can listen, and I think you said this earlier, be present with them and listen to what they have to say and to validate what they're experiencing. I think a lot of times adults, in particular with young people, if a youngster says that they're depressed, the parent kind of laughs that off and says, well, what do you have to be depressed about? The fact is that if a youngster says they're depressed, they heard that and feel that from somewhere. And so what we should do is validate the fact and then have a conversation with them. Well, what does that mean to you? Why do you say that you're depressed? And so we need to be able to get to a point where we can actively listen to what people are saying, as opposed to talking too much.
And kind of to piggyback on that, I've had the gift of being in higher education for the last 36 years, and 29 of those at Johnson County Community College. When I started in this position as a counselor, mental health wasn't a big focus 29 years ago. It wasn't a prevalent conversation. And so I would say that even with all of my training in the beginning, as I started to do more continuing education, certainly seeing the trend in mental health, that to Tim's point, the wonderful program of first aid mental health that Johnson County provides all the counselors at JCC, we go through that every 2 to 3 years, and then there's also some additional levels. But a lot of that is what Tim said, is that I guess what I'm trying to say is I respect that it sounds uncomfortable and people feel responsible, or it's kind of scary at first. And really it's a matter of being, like I said earlier, being present and maybe just asking those questions of, what does this mean to you? Or tell me more about when you say you're depressed, tell me more about that. And so it's learning to ask those open-ended questions that then gives that person to share. And then that burden isn't, we always see the big, the world on the weight of somebody's shoulders. And then that just, if you can think of it as, if they can share more with you, then that weight is coming off of their shoulders, and that support system's there. But again, for the individual that doesn't have a lot of background, it doesn't have to all then stay on your shoulders. So again, that's that support system I was talking about, and being able to reach out to others that can help carry that experience. I don't want to say burden, but it is for the individual that it feels like a burden, that they're burdening somebody else with their information. But I can guarantee you, if you can spend that, time just being there and asking those open-ended questions, that you are making an impact for that individual at that time and potentially saving them.
So one of our first questions circles back to the mental health professionals involved with police stops and calls. And can you talk a little bit about how those professionals are involved with those stops? And are you involved with training police officers on how to quickly access resources?
Certainly. So, the involvement with law enforcement actually started a long time ago. My first job at Johnson County Mental Health Center, when I was hired as a team leader for what they call the mobile crisis team, which at the time we worked with a couple of larger police departments, in particular Overland Park and Olathe, in their community policing programs to really focus on crime-free neighborhoods and being able to respond to behavioral health issues then. Over the years, what we heard from law enforcement was, it's great to be able to have you guys respond, and at 2 o'clock in the morning, we get paged on our pager and we respond, and it would take us about 20 minutes, 30 minutes to get up and get dressed and to get out there. So we heard repeatedly from law enforcement, we wish you could just be with us. We wish you could just be with us. And so that's really where the whole idea of co-responders came from, was that we began to continue to work with them on mobile crisis response. We started doing something called crisis intervention training, or developing crisis intervention teams, which is a 40-hour course for law enforcement officers. If you are having a behavioral health or mental health crisis and you call the police, you can always ask for a CIT trained officer. They wear a separate little badge. They have their police badge, but they have a little round pen that says CIT. And CIT means that they've been trained to deal with mental health emergencies. These individuals have self-selected to be CIT trained officers. Now, some departments are moving to 100% CIT training. I don't necessarily know that I agree with that, because I like the idea of some officers. There are some officers that they're there to be law enforcement. There are other officers that are there to be public servants, which they're both public servants, but one has a more social worky kind of approach, and the other has more of a maybe militaristic approach. And so those individuals that have that CIT training are officers who say, this is what I like to do. And so you can always ask for a CIT trained officer. Right now, as we continue to develop our co-responder program, our co-responders are mental health center employees, and we just embed them into each department. In fact, the cities are the ones that pay for them. So this is an example of where cities have seen the value of embedding law enforcement officers or embedding co-responders in their police departments. And like I said, we have 21 right now across all jurisdictions in Johnson County, and they are licensed mental health clinicians that are embedded with the law enforcement. So when they respond, if they get a 911 call and it's very clear a behavioral health call, then that co-responder and that partner, their CIT trained officer, they're teamed up, they will respond. There are some smaller departments that they don't have the teams yet. They just have a co-responder that has a car, and they'll be dispatched by 911. They'll say, I believe this is a behavioral health call. Will you head that direction? And when we say behavioral health call, it can be a domestic violence situation. It can be just something that someone's having a difficult time. They're exhibiting odd behaviors or whatever it might be. It may be a substance abuse kind of issue. Or it may be a situation where someone's suicidal. So depending upon that situation, that police officer may respond right there on site with a co-responder, or a co-responder may be called in.
There are several questions here about what I would consider special populations, or, instead of thinking broader about the community, thinking about, subsets of the community. One in particular is asking about how seniors can access mental health care. And then also, as a part of that, how they can encourage their colleagues, their friend group, their family members to access mental health care.
So the issue of older adults and mental health is an issue that we have to continue to figure out. Unfortunately, Medicare does not cover and provide much mental health coverage, and in particular the types of coverage that older adults need. Older adults are less likely to want to come in to the mental health center, so we need to be able to go to them. So we need to go and see them in their homes and do community-based work. Medicare clearly does not pay for those type of services. And then there's kind of a separation. So even within the county, we have our aging and human services, and they're in one department. We have mental health in another department. We need to be able to continue to try to find a way that we can overlap and integrate some of those services for older adults. So that is something that is on the Board of County Commissioners' radar. It's on something that's on my radar, as well as the area agency on aging, that we need to be able to begin to find a way to do that. The key in my mind is that we need to advocate at a federal level that Medicare cover community-based mental health care for seniors, so that we can provide what we call case management and home-based therapy in people's homes, as opposed to making them come to the mental health center. So there's still a lot of work to do in the area of mental health for older adults. But that is one area, and I don't know if your research around suicide has increased, but we see in some of the research that we see an increased number of older adults that die by suicide, and we actually also see an increased rate of bullying among older adults. And so, we think of bullying happening at schools, but having bullying happening at senior living facilities and things like that is really something that needs to be addressed as well. So there are a number of issues when we talk about the older adult population that we need to focus on.
Sorry, there was another question that was related to that, and I'm struggling to find it right now. Here it is. Right. That relates to another question, which is about, do you take volunteers? Can people come into the mental health center to get training and maybe they can go volunteer in a living facility to educate the population there?
So right now, at this moment in time, we don't have a volunteer program like that. That's kind of an intriguing thought. Part of the issue is, as we continue to have a workforce issue, we're going to have to get creative and look for different ways to do that. And so that might be something that we need to look at and that we can look at. Of course, that means that I would need somebody to kind of facilitate that process. But one of the things that has happened over and usually when I talk with groups like this, I always talk about the lack of funding for mental health care. I will say that there's been a shift, and the shift has been in a positive direction. So, we are roughly about at our 2008 funding levels. So what I mean by that is that we had been cut tremendously, and we're finally back to about 2008 funding levels at the state. But last year, the legislature passed something called CCBHCs, Certified Community Behavioral Health Centers. And what that does is create a new funding stream for mental health centers. We are in the process of becoming certified as a community behavioral health center, and that will provide us the opportunity to be paid based upon our cost, not on a service rate delivery. So most mental health centers, you provide a service, you get paid for that service. It doesn't pay you the cost of that service, it just pays you a service rate. So moving out of what we call fee for service model into a cost-based reimbursement, that's huge. I could see an influx of maybe close to $7 million in the next year of new funding. That's going to allow us to be able to do some different things. It'll be able to allow us to look at providing some of that older adult services. It may be able to allow us to be able to hire additional staff to do, some volunteer coordinating, things like that. So some of the things that we've always said, I wish we could do that. We may be able to begin to move that direction. And that's one of the reasons why we've been able to look at partnerships. We have partnerships with Johnson County Community College. We have partnerships with our Department of Corrections. We have partnerships with our department that serves individuals with intellectual disabilities. And so I think what you'll see is an increase in number of partnerships and collaborations across the mental health center with various entities within the community. And that will be primarily made available to us because of this change. It happened last year. I don't think many people know about it, but it was the single biggest piece of mental health legislation since 1990. The League of Women Voters was involved with the passage of the Mental Health Reform Act in 1990, which infused a whole new level of funding into the mental health center. And since that time, we've had no additional funding. This was the single biggest piece of legislation in, 3 decades, 30 years? 30 years. So it was huge, and it was a bipartisan bill that passed. And at this point in time, it appears that it's going to be fully funded. That was one of the concerns that I had. Is it going to be fully funded the way that they said it is? But as it stands right now, it appears that it's going to be fully funded. And so this is huge for the state of Kansas. It's huge for the people that support mental health, and it was a big step for our legislature to pass the CCBHC bill last year.
Was that state or federal?
It was state. The federal government has created grants to create community behavioral health centers. But we are the first state to create a state,
Wow.
No. Here's the thing about Kansas is that Kansas was a pioneer in mental health. Menninger's Clinic, the state hospitals in the 60s, even into the 90s, we were a leader in mental health. And then things started to kind of fall off. And our mental health system has been in a state of disrepair. Mm-hmm. There is a movement in the right direction. And it starts with the leadership at the state. And it's begun to look at what can we do as a state to look at things differently. And passing that CCBHC bill in the state, we're the first state that passed it, the first state that created and committed to developing what we call a prospective payment model, PPS, which is that cost-based model. We're the first state to do it. And so there's a lot of states that are looking at the state of Kansas to see how this rolls out, so that it's not just that it's a combination federal state partnership as opposed to just being federal or just being state.
Great, thank you. We have some other questions here related to substance abuse or folks with eating disorders. I'm curious what kinds of mental health supports, either through the college or through the Johnson County Mental Health Center, how you might respond to those kinds of issues.
So those are really specific disorders, in particular when you're talking about an eating disorder that takes some specific training, and there's a lot of overlap with physical health care. Sometimes that takes a little more specialized training. We do provide services for people that have eating disorders. There are a few specialized programs across the nation that specialize in eating disorders, but it's a tough one, and it's one that I think we can probably do a better job of preventing. I mentioned this earlier. This whole need to be perfect. I was meeting with some students from Zero Reasons Why, and we got to talking about eating disorders. And one of the students shared with me that she went out with 5 of her friends, and 4 of them didn't eat. She was the only one eating, and it's because they didn't want to eat because they didn't want to gain weight. When we think about Instagram and taking pictures, and we use all these damn filters to make ourselves look thin and pretty and not real, that just permeates, and it just continues to move this message that you have to be perfect. You have to have this certain kind of body. You have to have this certain kind of image, and that just perpetuates those type of eating disorders, both for men and women, frankly. And so I think that we need to do a better job of maybe doing some preventive work up front. Then maybe we wouldn't have to spend so much time working with folks that have severe eating disorders that are putting their lives at risk. It's also important that we realize that we have to address both the mental health and physical health again. I keep saying that. Come July, we'll actually have a physical health care clinic at the mental health center. So we're embedding some physical health care, a primary care physician within Johnson County Mental Health Center, so that we can actually address both. It doesn't help me do any good if someone has schizophrenia and I help them manage their symptoms of schizophrenia and they walk out the door and have a heart attack. Haven't done my job. So we need to actually do both. And that's the challenge for those behavioral health or eating disorders is to be able to both address the physical health as well as then the mental health piece of that. Substance use, again, we need to do more prevention. In our community, there's an acceptance of underage drinking. In fact, we have parents that promote it. And there's this acceptance of legalizing marijuana. And we don't need to get into the debate about whether we should legalize marijuana for medical uses or whatnot. But when you start to hear kids say that we want to be a 420 state, that means they want to be able to access marijuana. And we see what's happened in other states that have legalized that. When you start to introduce substances to the developing brain, and the brain's not developed until 28, something like that, it does bad things. And so substance use and substance abuse, we again need to do some preventive things. We need to not accept underage drinking, and we need to be more thoughtful about our approach with legalization of marijuana and other substances. And then we also need to be aware that this creates a whole nother level. The way that you get drugs today is not like we used to get drugs. You don't go to the shady corner and make a drug deal. You call your dealer on Instagram and you meet someplace, or they deliver it like Grubhub at your door. So there's a whole new way of that business. And so we need to be able to address that and do some preventative work up front. At the mental health center, we are, and we do provide both mental health, and so when I say behavioral health services, I'm talking about mental health services as well as substance abuse services. So we have a full array of substance abuse services at Johnson County Mental Health Center as well.
Did the college, again, being a community college, we do partner with all of the resources that we can refer students to. So we do have partnerships, again, beyond Johnson County Mental Health. There's quite a few organizations. Renew is in the area for eating disorders. And again, from an educational perspective, we have those educational weeks or educational months on the campus. We do a lot of programming with, and it's student driven. And so again, getting that, we were talking about the senior care and peer-to-peer. We certainly have that model at the community college where we have students that are doing that's a passion of theirs, whether it's eating disorders. We don't do a whole lot on, as far as programming on substance abuse, other than education and awareness of that. But with the eating disorder component or substance abuse, at the community college, what we sponsor or what the college provides is, in addition, if the student meets with us as a counselor, and usually what it is, they're coming in oftentimes to say, I'm not doing well in a class. And then we start asking those second and third questions. So whether, and eating disorders are huge, a big number. And so we do have at Johnson County Community College a student assistance program where we do partner with an organization. One was ComPsych that we've used. We're currently with Belkenich. And so Johnson County Community College will pay for 5 sessions with a therapist. And so we can get them immediately referred to a therapist in that specific discipline or a training on eating disorders. And our students can have that connection. And then after those 5 sessions, they can help them get connected with ongoing therapy or potentially take them on as a client. So it's a wonderful database in our area. It's a national company that we work with. They contract with therapists in the area, and then we just call from our offices. We help that student get connected, and then we follow up with them as counselors, but we can immediately get them with someone that has a specialty in the area of eating disorders. So again, a lot of resources there. One of the issues I will throw out here, only because I dealt with it yesterday, on abuse, sexual abuse, sexual assault. I had a student that was at the police station just yesterday, was on campus for an event, ran into the person that she had been in a violent relationship with, had an immediate PTSD reaction, ended up in the campus police area. We were called in counseling. I went. We also partner with MOXA, the Metropolitan Organization to Counter Sexual Assault, and we actually have a MOXA member on our campus as well who meets with students. And so I was just really proud of our community college here in Johnson County that individual immediately had support within 15 to 20 minutes of having this experience on our campus. So that's part of the mental health piece that we deal with too. And so again, it's partnerships with MOXA, with Johnson County Mental Health, with outside providers that we reach out to. And so those resources are there for students, or our community. And when I say students, again, we have our 60+ program where people take classes on our campus as well. So that's for any of our students that participate on campus.
One thing that I just want to add to, the mental health system is built to be responsive to situations, and that's good. But what we need to do is begin to move upstream. And I think this is where maybe the League of Women Voters can also be helpful, is that's not where policymakers want to focus their energy. They want to focus their energy on the here and now, and not 5 years or 10 years down the road. The fact is that most of the things that we're talking about right now are all preventable. Mm-hmm. They're all preventable. We just need to take prophylactic measures upstream to be able to manage some of the things that are going on in people's lives so that we don't get to the point that we're talking about. And so that we are addressing the issues of perfectionism, that we're addressing the issues of loneliness, that we're addressing the issues of underage drinking or drug use or whatever it might be. The fact is that major mental health issues are preventable. The research is clear about that. We just have to be willing to put money into something that we can't necessarily see this minute. Mm-hmm. And that's not what policymakers are usually wanting to do. So what we need to do is focus on prevention. We need to focus on providing funds to create prevention avenues and programs so that we can actually get out of the model of just being responsive to situations in our community.
Great, thank you. I think that's a great end in terms of, the big takeaway from this program is that the things that we're discussing today are preventable and that we can all contribute to that effort. I do want to say before we turn it back over to Janet, we have a lot of questions here I was not able to get to, and a lot of them dealt with the apps and the phone numbers. We will collect answers to those questions and send them out. So if you were registered, we will make sure to get your questions answered.
How was anybody that's in the room now part of the league back in 1992 when we had played such a big role in getting the mental health center funded? Tim, we have, sorry.
Oh,
Tim,
sorry.
pay attention.
We're making some plans.
We have a member raising her hand.
Okay.
Who helped with, was part of the league in 1992 when the league helped underwrite. That's quite amazing. Thank you. So Andrea, to you, thank you so much. Tim, wonderful. Alicia, I think we all learned so much. And a case in point, we've had this constant beeping for 2 hours, but we managed our feelings. We're able to.
We got through it.
We got through it together. So thank you all very much.
Thank you.
And you're welcome to mingle or leave, or you could just sit there for the rest of the program. So now I'd like to introduce, can you hear me on this? It's my pleasure to introduce Missouri Representative Emily Weber, who represents District 24 in Jackson County. She was raised in rural Kansas after being adopted from South Korea. She attended Butler Community College and the Kansas City Art Institute. In addition to serving as a legislator, Emily is a graphic designer, activist, plant lover, and avid voting rights advocate. She sounds like a league member, doesn't she? Please join me in welcoming Emily today to present our DEI moment.
Thank you so much. So I just got back from Jefferson City last night. So I'm happy to know that this has been going on for 2 hours and it's not in my head. And I'm happy. Okay. So good morning, everybody. Thank you so much for having me attend your League of Women Voters meeting. This is great. And I am really happy to know that I'm not hearing things. So like a little bit about myself, I was raised in rural Kansas, Colwich, Kansas to be exact. And, you know, I've done a lot of different inclusion and diversity meetings and kind of just conversations about what that entails. My upbringing was a little different. You know, my parents were white. Me and my sister were Korean. We were raised in a very conservative town that was dominantly white. My brothers were white also. So we had to have lots of conversations around this topic because my parents adopted so many kids. A lot of the times they would internationally, a lot of the times other families who were looking to adopt internationally too would come over to your house and have conversations about what that entails and what that looks like. So having conversations like this isn't a problem for me. We're a very open book. So growing up and then deciding to move to Kansas City was a big leap for me. It was very different. And then in Kansas City, I became very involved in my community, something my parents always raised me to do, and started joining other organizations or groups. And a lot of the organizations and groups always have conversations about what diversity and inclusion looks like. And in some groups, that they mean well, that you can do harm. And sometimes I have seen groups invite others to the table, but not really listen to their thoughts or needs. That can do some damage because instantly that person is going to feel left out or attacked and then leave. And so when we talk about diversity and inclusion, really it's looking at what is it that you can do as a whole. You know, urging others to join your group or organization, but also allowing them to have the voice at the table as well. And making sure that you are open to their suggestions or their heritage or some of the things that you might hold that they might see problematic. For instance, an organization that I belong to had some instances where they did open up because they wanted to have more diversity and inclusion, meaning younger people of different ages, different races, different sexes. But then when it came down to planning some of their events and meetings, it was a problematic because it was not the way that they've done it in the past. And so that is number one key is, you know, you can't urge them to join and want them to do the things that gear towards their audience and then tell them that's not what we've done in the past. So that could be a big issue. So month of May is AAPI month, and I've always talked about this as a legislature. The first term that I served, or first year that I served in the House, was of course during the pandemic and during the AAPI tax. So during that time, it was pretty bad because there was a lot of Asian Americans that were getting attacked and harassed. And a lot of people weren't listening to why we should not say terms like China virus and things like that. During my time as a state rep for the 2 months that I served my first year, there was other representatives that were using the term China virus when they were talking about COVID on the floor and in committees in the Capitol. Because of who I am, I was not going to stand for that. So I decided to do a basic HR complaint to make the representative stop. But because of that, I was then termed as, you know, oh, I'm too soft, I'm sensitive, you know, things like that. I'm a liberal. But at the same time, a week later after I did that, the Atlanta shootings happened. And my whole stance on why I wanted the term China virus to be stopped on the floor of the Capitol is not because of me, but because this is the people's house. And anybody who comes into the people's house who is Asian American and hears this on the floor is going to feel attacked. They're not going to feel welcomed. So I was doing it for the people who come in or who have been listening. So after that has happened, the term has now stopped. Some people started to understand, but I do believe that representation matters. And if I wasn't there, that wasn't going to happen. Nobody else is going to stand up and say, this needs to stop and this needs to end. So that was my first few months as a state rep. And since then, you know, I do believe that, I strongly feel that representation does matter, and trying to gather as many other people who might be different like you or different looking than you, but like-minded. You know, they want to get more voters. And I feel that the way that you can start doing this and things like that is gearing towards going out in their communities and understanding a little bit of their heritage or learning from their heritage. And then asking them to join and bringing them to the table to have a voice. Because right now, especially in the state of Kansas and the state of Missouri, with AAPI voters, we don't vote. We don't vote, but we can vote. And there's a big number of us, especially in Missouri, where we could have flipped some seats if we all voted. And so a lot of this is understanding how to target them to gather and join, to make them, to allow them to understand why voting matters and why their voice matters as well. Because right now they don't feel like they have a voice, but they also don't know where to go or who to join. So my eyes with the diversity and inclusion part of this, I would feel that trying to gather as many people as possible, because we all know in the next few years, it's going to be really rough. And we need as many voters as possible to get out there and vote in every single election. So yeah, that's what I got right now.
Thank you very much for that. Next up, we'd like to introduce Connie Taylor, our co-vice president and the famous redistricting champion for the state. She'll give us an update on redistricting.
Okay, so we have two close here.
Yes.
All right. So, couple things. The congressional map, the Ad Astra 2 map, was challenged in court. The judge pulled all three of those cases together and heard the case in Wyandotte County. The judge ruled late April that the maps were, in fact, gerrymandered both on racial lines and partisan lines. All parties concerned in those cases knew that regardless of the ruling, it would automatically be appealed. It would automatically be appealed. That happened almost instantaneous. So it's in the hands of the Kansas Supreme Court. They will have a hearing on May 16th. The other thing that happened, according to state statute, the legislative maps, so your state house and your state senate maps, there's a process where after the Secretary of State publishes the bill in the Kansas Registry, the Attorney General has 15 calendar days to petition the Kansas Supreme Court. That happened right along the same time frame as the judge issued the ruling on the congressional map. So that starts a different clock. Now the Supreme Court has 30 days from that filing to issue its ruling on the validity of both those maps. The other thing that is important that I want you all to know is that the public can submit a written statement that you're an interested party about the validity of the maps. So what happened was the League of Women Voters of Kansas, the People Powered Fair Maps Working Group, put together a written statement complete with what we felt were violations of the rules that, the guidelines that both committees agreed upon. We had a written summary. We included screenshots of maps where we said this is a problem area, this is a problem area. And we also included some really interesting population tables. That will be signed and hand delivered. It will be signed by our co-presidents with the League of Women Voters of Kansas, and will be hand delivered to the Kansas Supreme Court. The hearing for those maps is on the same time frame, and it will be heard on May 16th. So that's where we're at. So we did submit we are submitting a written statement about the validity of maps.
If you were on the redistricting team with Connie that met every week, I see Nancy Allen, who else Marie was on it. If you were on it, can you put your hand up? We owe you a debt of gratitude. So now I'd like to introduce Jill Quigley, our voter-to-voter champion, and who has an important invitation for you and information about the Kansans for Constitutional Freedom Vote No campaign.
Thank you.
Hi. Well, with the leak of the draft of the Supreme Court decision, I think it's fair to say that interest in reproductive rights and in the constitutional amendment that we'll be voting on has definitely jump-started. League has two committees or two groups that are working against the amendment. One, we're calling the Advocacy Committee, and it's being led by Danielle, back to back. And the other is the Voter-to-Voter Committee. We have been involved in Voter-to-Voter for a number of years. It's a mainstream program, and it is all about identifying and working with people that you know to get them to the polls. You know, it's a relational get out the vote effort. And that means people you know are more likely to vote if they are asked by people that they know. And that's what this program is all about. We have, in the past years, our goal was just to get them to the polls. We identified them, we sent them information, and we tracked them to see if they went to the polls. This year, we have an additional goal. We are going to get people to the polls to vote against the constitutional amendment. So we're taking a stand. As you probably know, the National League in January of 1983 had stated a position on reproductive choice. I'll read it to you. The League of Women Voters of the United States believes that public policy in a pluralistic society must affirm the constitutional right of privacy of the individual to make reproductive choices. So we have a position statement, and we have decided to advocate for that position statement through Voter-to-Voter this year. So we're going to give them information about where and when to vote. We'll also be asking them to vote no on the amendment. So we'll be providing two sets of information. So I don't know if you've been involved in Voter-to-Voter in the past, but I would encourage you to get involved in it this year. There are sign-up sheets. I don't even know if they got started around the clipboards, but we'll move them to the back. And where Danielle is setting, we have information back there. You can sign up for Voter-to-Voter. In the past, people have been found the app a little difficult to use. So has anybody done Voter-to-Voter? Yeah. Okay. The app has been a little tricky. Every year they improve it. I have a computer back there. I'd be happy to sign you up for the program. And then we can have training sessions if you need them with the app. But I do think it has gotten easier and easier to do. But I commit to helping you if you have trouble with it. It's always challenging to get people out for a primary. And frankly, that's what the proponents of this amendment, that's why they put it where they put it, because it's a low turnout primary generally. So we have extra work to do to get them to the polls. And we have to get out the message that unaffiliated voters who usually do not vote in the primary, because usually when they go to the primary, they have to declare a party, which they don't want to do. So the message we have to get out is that unaffiliated voters can show up at the polls. They do not have to declare a party. They will be given a ballot that just has the constitutional question on it. So that's a really important message to get out to people that you know are unaffiliated.
And any nonpartisan primaries.
Pardon?
Johnson County Board of Commissioners has nonpartisan primary.
Yes, it will also be on the ballot.
Yeah.
There will be one race on there, but it's nonpartisan, so they don't have to declare a party in order to get that. Yes.
I've been
reading in the newspaper or following this, and they are talking about the deadline to, you have to affiliate. And that's the wrong message and the wrong information, and how do we beat that back?
It is, and join voter to voter and get the right information out there to your voters. And I think, looking at the numbers of where people stand right now, it's, they're saying 48% are against the amendment, 46% favor it. So it's very close, and it's going to depend on turnout. I want to be sure to tell you, well, first of all, there are 2 flyers on your seats I want to call your attention to. The green one is voter-to-voter information, tells you how you can sign up. And this one has so much information on it. It has on the back effective conversations, how you might talk with somebody. These are some talking points that came out of focus groups. So I'd suggest that you look these over and maybe give them a try. The actual wording of the amendment is on this sheet. I know that's been hard to find for some people. League is part of a group called Kansans for Constitutional Freedom. And it's being led by the ACLU, Trust Women, Planned Parenthood of the Great Plains, and URGE, and then many other groups of which League is one. They have a website. They are leading the advocacy against this amendment. On May 14th is their kickoff. We've all been anxious to get yard signs and postcards and bumper stickers and t-shirts. That's the day they're going to be available. If you go back to Danielle, she has a computer. We can sign you up for that day. There are 2-hour shifts all day long. They're asking you to canvass. That's going door to door. I know that makes some people a little nervous. But the word is that we will be going to the houses of supporters. So it should be a fairly easy conversation. If you don't want to do that, there are phone banks. They will be giving us postcards. You can send postcards to your friends. So League is organizing with this coalition, and our big kickoff is May 14th. I really encourage you to get involved in that. Sign up with Danielle, and you'll get more information sent to you. Let me see if there's anything. Any questions real quick, or come to the table in the back and we can answer any questions you have. Thank you.
Speaking of voting, we are entering a partnership with the United Methodist Church of the Resurrection. Is anybody familiar with CORE? So CORE is the church that has 5 campuses across the metro area, 2 in Missouri, 3 in Kansas. They have invited us to be a partner with them in a new project called the Civic Engagement Project, which is part of their DEI program to ministry. So we have been invited to attend on June 18th and 19th, the next weekend. We are invited to have a League table at 17 services at all 5 campuses for the purpose of registering voters, for voter engagement, to letting them know how important the primary is, and to talk about the League of Women Voters. So we need a lot of help for that. 17 events over 5 campuses, 4 days. So we have a table in the back. Marie and then Claire is going to be back there to sign you up, and if you're interested, and then we'll work out the shifts. Tanya, would you stand up? Tanya is our now new co-leader that's going to be helping us with this charge. So thank you so much. So, as I said in the beginning, this league accomplishes a lot. So please check our league website. Thank you, Mitchell, for keeping up our website for information about a plethora of upcoming events. June 4th, we have our Mainstream Walk. Souls to the Pole, one of our favorite events, is coming up in July and October. we've just got a lot going on, and what we're doing is important and necessary. So thank you for being here. Please feel free to hang around, talk to each other, socialize, because it's good for your mental health. Thank you.